Hello, everyone. I'm Dr. Renee Mehra, and my guest today is Dr. Anupama Gotimakula. She's the current president of AAPI, the American Association of Physicians of Indian Origin, which is one of the largest ethnic medical organizations in the United States. Welcome, Dr. Gotimakula.
Thank you, Renee, and thanks for giving this opportunity to talk a little bit about AAPI, the Organization of Indian Physicians in the United States.
Yes, AAPI started in 1982, so it's 4 decades. And share with us some of the milestones that AAPI has had in the last several years.
Yeah, so AAPI is formed by a bunch of physicians in Michigan, actually. This was in early 1980s, and they were struggling with some discrimination issues in the residency and jobs and all. So that's how they thought, like, we need a voice for ourselves. We need an organization. That was the birth of AAPI in Michigan. And we are almost 40 years now in 2022. And in this 40 years, there's a tremendous growth in this organization. As we see, Indian physicians have been immigrating to this country for their goals. A lot of physicians want to achieve some specialties which they can do in India, or, whatever reasons they have, family reasons, or, spouses come and then the husbands or wives come. So there are multiple reasons why doctors come to United States, but everyone is a really very high achieved physician in India. And these are the cream of India, I should say, who are here in this country. So currently, right now, we have at least 100,000 physicians working in United States, because as per the AMA, they run statistics every year. American Medical Association has 1 million physicians in their database, and we are almost 10% of that database. That's how we know that we are 10% in this country. And there are also 10 to 15% in every medical class, almost in every medical school now. So that's almost 10 to 15,000 young physicians and residents and students and all. So pretty good representation. And also AAPI, every physician, Indian physician, as per the statistics, 1:7 or 8, patients are seen by an Indian physician. So, and these physicians are located in the rural most part of United States because of their J1 visa waivers. They have to work in rural areas. And we see a lot of physicians in the academics and private practice. A lot are primary care physicians, almost 60 to 65% are primary care physicians, and rest are all specialists.
Yeah, that's where the need is most, because we see so much of inequities,
in
the rural sector.
Right.
Now, in January of this year in Hyderabad, AAPI just had a 3-day global healthcare summit. And for the first time in AAPI's history, half a day was allocated to the lifestyle medicine event.
Right. So, I started with a theme this year, Renee. It's all about, our focus should be more on the prevention and how do we control these diseases, just not by curing the diseases with medications, but are there any other ways? So I kind of from myself discovered the lifestyle medicine as I started changing my diet habits, and I saw a sea of change in the blood pressures going down, like from 130s to 110s. Then I realized there is something in the diet. So somehow I explored more, and then I saw this lifestyle medicine, and I thought, these are the principles which should be incorporated and to be followed by each physician, and their patients should be counseled or educated on these 6 pillars of lifestyle medicine. Now I'm like so thorough that I know what they are. So I did some things I discussed with the lifestyle medicine experts, and introducing them slowly into AAPI, and now we are almost having conversations with the leadership of American College of Lifestyle Medicine, because most of these are physicians who are practicing, and most of them are also experts in lifestyle medicine. So this goes hand in hand with their practices. So every physician should follow these principles, so that way they can take care of good health of their patients. By following this, they can even reverse the disease. So like sleep and diet and exercise and social networking, and alcohol and other habits, and also these are all the 6 pillars which, if we follow very traditionally under the guidance of an expert, I think there have been tremendous examples. My husband himself is an example how he could bring his every lab to normal almost. So that changed my thought process that this is what we should do. So why not through API?
Especially during this traumatic times, the pandemic, stress management or sleep management, physical activity.
Much needed now, right? This COVID pandemic. Yeah.
Under your watch, you have a lot of initiatives. Adopt a Village, which is actually in honor and celebration of India's 75th year of independence, Azadi Ka Amrit Mahotsav, and it is Adopt a Village in the rural healthcare sector initiative, where you are doing free healthcare screenings. Shed some more light on this project.
So the preventive theme, I thought let's start in the villages in India. Rural health is pretty bad, and they have very poor accessibility. So I thought, let me start this, with the collaboration of a friend, and he's founder of this global teleclinics, and he practices lifestyle medicine in his daily practice. So he said, why not? And then that's how we thought, let's do in 75 villages, because it's India's Independence Day. So let's do that way. So what we did is we kind of made a system ourselves. So screen the villages with all these comprehensive lab tests, and they have a team on the ground who have been doing this already. So that made my job easy. So we are screening the villages, and they get checked for everything like cholesterol, blood pressure, A1Cs, and renal, and blood counts, and height, weight, and oxygen saturation. So those are the parameters we are using. We are screening for non-communicable diseases like hypertension, diabetes, etc. And so now we finished almost 24 villages, and we do have the results analyzed. And we also have a physician who is going and doing the physical consults in the villages once they got the labs. So we're having a physician first consult given, then later on we want to adopt them every year so that they get these annual physicals. So the goal of these, in this evolution, we figured out that the goal for India rural health is still poor, and they don't go to the doctor unless they become sick. But this is in general for anyone. We have screening guidelines here in US, like preventive screening guidelines. You have mammograms, we have all these pap smears, and you have, at certain age, you get the colonoscopy, and you get your sugars checked, labs checked every year. So there is a screening, US, United States Preventive Task Force. They have these guidelines. India does not have those guidelines yet. So we thought, let's, do this homework first, and then we can push them to get these guidelines made for India by the Indian government. So we are kind of in constant contact with the health department in India. So that's why we thought, if they start this, maybe healthcare will be in the better side. If we have those guidelines, and, doctors also, we should have more doctors who practice primary care rather than everyone running for specialties and all. So primary care is very important to, have these screenings and then take care of these patients at the early stage of the disease, rather than going to the end stage of the disease to the specialists. So that's what the concept is, and I think we are doing really good.
Early intervention is the key. And you're also providing biochemical analyzers?
So when the Delta COVID was bad in India, like a lot of people dying, we raised some funds for COVID, and then we almost raised $5.5 million in that first phase, like when it was peak that there was no oxygen available. We had sent oxygen concentrators, and then we had also sent some ventilators in India, and there are still more ventilators available to donate in India. So that's one thing we did. And after that, the COVID went down. They went into almost like, lowest numbers. And again, they started seeing the rise. So we have these funds, and we are doing long term, like what else we can do to help these COVID hospitals. Like each and every small nursing home became a COVID hospital during that peak. So what if the next wave comes? What can we do to help? So we picked up many charity hospitals, nonprofit hospitals, in the rural setups. So those are the COVID hospitals we picked up, and then we are helping them with these biochemical analyzers. So the biochemical analyzers can run the tests, and they can run 200 tests per hour. So that's the capacity of these analyzers. So the biochemistry departments, we have talked to them, and they have offered they will take care of them, and further maintenance. And also those are the hospitals we are giving the biochemical analyzers. And there are some hospitals which are still asking for ventilators, adult pediatric ventilators. So we are going to continue the good work. And also oxygen plants, there are some rural hospitals who are asking for oxygen plants. So these are the hospitals which have that scarcity. They have to go and get the tanks and all. So instead of they can have these own plants in their own hospitals. So that's what we are doing now. So all the funds we want to spend for the good cause. So we kind of handpick, talk to the programs directors and hospital administrators, and then with their consent and everything, we are doing this good work. And we are still thinking what else we can do to spend for the COVID relief work in India.
But this requires a lot of funding and resource management. So are you partnering with a lot of public and private sector companies in India?
Mm-hmm. Yeah, it's going really good. We are so satisfied for the work being done by this team of people from US they talk one-on-one, so it's a lot of work, thorough work. Yeah.
And it is an ambitious project. Coming back to US, your annual convention is going to be in June, I think June 23rd to the 26th in San Antonio, Texas. Mm-hmm. And the keynote speaker is none other than the cricket legend Sunil Gavaskar.
Right. So
the theme is physician, heal thyself. I think that's a really
right.
Yes.
Yeah. So heal the healers. So we all know that it's a pandemic time, and I think this is the first biggest convention we are doing in the last 2 years. The last 2 years conventions, one did not happen in 2019, 20 in 2020, a small group met, but this is again back to our pre-COVID numbers. And so what we are doing is, this is the heal the healers. Like we are all we are the healers, right? So we also need that healing. So our focus is on those topics. So we have wellness packages. We want to introduce yoga and meditation, and also we have excellent speakers, world-renowned speakers actually in the wellness package. The speakers are amazing. If we look at the website AAPI Convention.org, that's a website you can browse and see who the speakers are. And Sunil Gavaskar has the H2H Foundation, and he does this congenital heart surgeries for poor children who cannot afford treatment. Those are the patients he supports through his foundation, and these are in Navi, Mumbai, and Palwal and other places, and Haryana. And so every surgery costs just $2,000 from the time of admission to discharge of the kid. So $2,000, we can have one kid get operated. So we thought, let's extend this good work, this charitable work, And so we have cricket bats autographed by Gavaskarji, and then we have, meet and greet, private meet and greet. So we are planning to have at least 50 bats, and it will raise at least $100,000 for Gavaskar's foundation. If we go more, that's good enough, but it's a lavish goal. Throughout the year, we have done some charitable activities all throughout the year. So I can go over and over again what we have done. But convention also has other keynote speakers. We are still in the process of bringing them. We invite all the highest, from Vivek Murthy, Dr. Vivek Murthy, and AMA president, and our Texas Medical Association president. We have the drug Caesar, Rahul Gupta. So he's one of the famous in the opioid crisis. He's the main person who gives his advisory for the, opioid abuse for the government. And so we have excellent speakers, and we are looking forward for that convention in June.
And that's June 23rd to the 26th in San Antonio, Texas.
You're welcome. Very welcome, Renee.
I'd love to. Dr. Gotimakula, I know that you're continuing, and AAPI is continuing its efforts to have a strong voice in healthcare reform and policy.
That's the main reason why we have initiated this Latte with Legislators. So we are having one-on-one conversations with our legislators, and we have sessions every other Sunday, every month from now onwards. And this is a good opportunity to bring some reforms in the healthcare. So as physicians, we daily practice, and we know what the pitfalls are for physicians, what are the deficiencies in our healthcare system. So probably it's our opportunity to talk to these legislators, so who make the policy changes. So we depend on them. It's like not only they depend on us, we also depend on them. So I think it's a mutually we hear to each other. That's how we can make a change in the system. So that's why we planned this through AAPI, and this is a novel system, and we have never done this before. In spite of having one visit to DC in April, but we thought let's use our Zoom technology and have this. So we have several legislators lined up now, confirmed actually, which is going to be really good. So let's see what the outcome will be. Hope our voice will be heard now to the legislators. They also know what AAPI is. So it's a very good win-win situation getting connected to our legislators.
Yeah, I think equity and inclusion are very, very important.
Very important.
Yeah, and AAPI is making strides in that through Latte with Legislators. And I think that's a great stride. What is your vision in the next 5 years for AAPI?
So AAPI, it's a very strong voice for physicians in the United States, and AAPI is the largest ethnic physician organization, huge numbers. So as we are growing in numbers, I think the point is in next 5 years, I know we have to be a leader in the healthcare section, like where we can bring some changes through our voice. Okay. And the second thing is physicians interact with each other. So apart from the regular routine stuff we do, like educational, charitable works and all, we need to address what you said, the health equity, where we are, the disparities, and the ethnic, especially South Asians, are much more prone for these discriminations going on. I think we need to bring that and see that this will stop. And so we have plans. We have connected with the American College of Physicians. We are connected to the AMA through the IMG section, and we have connected to the Federation of State Medical Boards. So these are all the organizations we are connecting with, so that way we all are on the same page that, these are all physicians. I think nobody should be discriminated based on the race or sex or anything. And Gender disparity is one more thing, so we can address that. So these are the few things. I think next 5 years, if the leadership can grow out of the inner regional differences as a one unit, I think if we go forward in the next 5 years, I think we're going to be a leader, sitting next to all these leaders of the healthcare reforms. And also we need to be one member everywhere in every organization. I think our representation should be there. So this is the start, and this is the year we connected to so many organizations and had several meetings with the leadership. I think hopefully the next leaders will take this to the next level, and in 5 years we can see AAPI flourish as one of the biggest organization. And yeah.
That would be great. And lastly, Dr. Gautam, what would be your message to the young medical graduates?
Yeah, young medical graduates, and here is the future. And healthcare is a very noble profession and service-oriented profession. So I think we all have to work for our communities. So that humanistic touch should be there with our patients. I think we are losing track with this telemedicine and all. I know the technology is advancing now, but I think the human touch should never be forgotten. And also, the students, the more we network with each other, I think the more we are connected with each other, I think the better outcomes will be. The younger generations, they are the future of the medicine and healthcare. So they should know in their curriculum what exactly is happening right now in the healthcare system. If they are well aware of that, the system is not correct right now, maybe they can involve and get into the leadership roles and get involved in these AMA and other organizations and learn the things, and then maybe they can change the future of the healthcare.
Thank you very much, Dr. Anupama Gautam, the current president of AAPI, the American Association of Physicians of Indian Origin. I'm Dr. Renee Mehra. Until we meet again, stay healthy, stay positive.